Hello everyone and welcome to this virtual presentation of my postdoc. My name is Martin Langeskov Christensen. I'm a clinical exercise physiologist working at the Department of Public Health at Aarhus University in Denmark. So let's begin with a short introduction to the topic. In MS, difficulty walking is a common impairment with prevalence increasing throughout the adult lifespan. It's also rated in the top 3 bodily functions by both physicians and patients. In MS, fatigue is also a very common and disabling symptom with a high prevalence and high impact on everyday life. We know it's a multidimensional and complex symptom, often leading to trial and error in treatment regimes. However, in the last 2 decades, we've seen that exercise may be a promising approach to alleviate fatigue and improve walking in patients with MS. Consequently, the aim of this study was to investigate the effects of a 24-week high-intensity progressive aerobic exercise intervention, followed by 24 weeks of follow-up on self-reported fatigue impact and severity, objectively measured walking capacity and self-reported walking ability, quality of life. We hypothesized that the intervention would improve self-reported fatigue impact and severity and walking ability. To assess this, we designed a 24-week randomized controlled trial with a 24-week crossover follow-up period. We enrolled 86 patients who were randomized to an exercise and a waitlist group. The test battery performed at 0, 24, and 48 weeks included the 6-minute walk test, the 6-spot step test, and the cardiorespiratory fitness test, questionnaires to assess fatigue by the MFIS and the FSS, quality of life by the SF36, and walking by the MS Walking Scale 12. The intervention progressively increased throughout the 24 weeks. And even though it was very high intensity in the end, we saw a good adherence to the intervention and only 3 minor adverse events. Data were analyzed using intention to treat linear mixed effects models. And please note here that these are secondary results from a trial primarily looking at brain volume change. So let's look at the results. First off, we saw no changes in the 6-spot step test or in the FSS and SF36 questionnaires. When looking at cardiorespiratory fitness, we saw an increase in the exercise group when compared to the waitlist group, and this finding alone may have important implications since cardiorespiratory fitness is a strong general health predictor associated with a reduced risk of all-cause mortality and cardiovascular disease. Furthermore, the between-group point estimate of -5.3 points on the MFIS suggested a clinically relevant effect in the exercise group as it exceeded the cutoff of -4 points. Importantly, this change was sustained during the follow-up period since the change here did not exceed +4 points. However, we must acknowledge the uncertainty given in the confidence intervals here. Lastly, the between-group point estimates of the MS walking scale and the 6-minute walk test suggested improvements in walking ability and capacity. And when looking at within-group effects, the exercise group exceeded the clinically relevant cutoff points in both measures of walking. And again, these improvements were maintained during follow-up. But also here, bear in mind the uncertainty given in the confidence intervals. So to conclude, 24 weeks of progressive aerobic exercise induced a clinically significant improvement in fatigue impact and seemed to positively influence walking impact and capacity. Given the secondary nature of these data, we can say that in the general population, progressive aerobic exercise may alleviate fatigue. It may improve walking, but these results need verification in well-powered studies. However, given the few, if any, adverse events when performing aerobic exercise, patients should be recommended to go exercise.